Well, hello and welcome to our Women's Health Edition, episode 5 of our Women's Health Edition. And we're going to be talking about testing your hormones and the importance of it and what test to order for your hormones. So um, let's talk first, Janet, about how our hormones fluctuate during a normal cycle.
So, a normal period, we start slowly after, well, even during menses, we start slowly building up our estrogen to prepare for the endometrium to be built up. So, we're putting a lining down, and that's part of the function of estrogen. So, the first part of our cycle as a woman, we are starting to prepare our womb to become pregnant. So we start building that up, and about day 14, 15, we start having a increase in progesterone. And why that's important is progesterone is balancing our estrogen, but progesterone's function in a healthy woman is going to start to prepare you for pregnancy. Ovulation is also part of progesterone's important part. But as we are transitioning, we are slowly building the lining with our estrogen. Our progesterone comes along. We get to a point where we say, okay, we're thick enough in our uterus where we can actually handle a pregnancy. So if we become pregnant, progesterone is going to maintain it. It's going to help with that procedure. But also, I mean, to back up slightly a little bit, progesterone helps with the fertilization process because it helps with the thick or the mucosal lining. Because when we release an ovary or an egg from our ovary, we want the right mucosal situation, environment. And that's really important for women to maintain and to help with the fertilization. So as we progress, if we don't become pregnant, we still are building with the progesterone, but we're keeping the estrogen down. When the progesterone starts to fall off, that's when we start our menses. So, Shawn, talk about the technical terms because this is probably what your doctor's going to say, not just how we discuss the estrogen progesterone part.
Well, the first half of the cycle where progesterone is a little bit lower is a follicular phase, and a follicle is literally an egg being released. So that's days like 1 through 14 of a cycle. And when that egg is released, that's when you're going to be most fertile around the middle of your cycle. And that's when Jen and I have talked in this series about, when you'll create mucus in the vaginal tissue to prepare an environment to be easier to have a pregnancy. The luteal phase, and this is where the and then in the luteal phase is when the endometrium is being prepared for implantation of
Right.
that egg. So that's when progesterone is usually the highest. So progesterone is higher the second half of the cycle, also called the luteal phase of the cycle. And when the progesterone levels drop off, that's when you have a cycle and that
It's just
endometrium
shedded.
starts sloughing off. So that's what causes the actual bleeding in the menses.
So as we age, it changes perhaps. I mean, some women can be just like clockwork, some slightly off, but I think what we are looking for is this term of what is a healthy individual. Well, most women that have regular cycles will say, I know this day, this day, and this day. They totally get it. They can mark their calendar. Some are not that way. However, health to me is really defined in a different way of what we are saying today on TV or mass marketing on social media. So to me, a healthy individual is in their weight that they should be, functioning, active, engaged in life, not having a lot of issues with chronic illnesses already. So, a healthy individual in our society is kind of maybe 50-50 or less. So labs can really be skewed because, again, you can pull labs from um, our population, and they're reflecting not very healthy people. So, what I tell people is this: if you know where you are at your healthiest phase of life, are you there, right? And the other thing to think about is if you're not, there could be some other things that are affecting this. Many times, Sean and I talk about sleep. That is super important. If you're not sleeping well, then you're not going to be metabolically healthy, especially if it's been a chronic issue. Or what's your exercise tolerance? Are you able to endure the same amount of exercise and be
Right.
healthy and feel good in it? Because that can change. The other thing is, we talk about the mental stamina. Is that changing for you? Are you finding that you are not as comfortable, or you're finding that you're shorter in your ability to handle stress? So, those can be some measuring sticks. Um, I think one thing that's super important that as we transition with perimenopause is that we also look at our thyroid gland. We've talked a little bit about that, but typically we start watching that in our 40s, but we probably should look at that earlier in life. But still, at 40, we should look at our thyroid function because that can really affect our metabolism. And when we're going through perimenopause or into menopause, we want to maintain a healthy metabolism. And why that's important is we want lean muscle mass, and we also want our metabolism to stay healthy to help us carry, because there's a transition that's happening. So we want our body to be healthy. So thyroid functions can be super important at this stage. I'm not a fan of just TSH because that really is thyroid stimulating hormone, which is a pituitary hormone that looks at whether or not the thyroid's getting the signal of make more thyroid. But you want to see what T4, the free T4 is. That's the inactive form of thyroid. And we want to know what the free form, which is T3, and we want to see what that's like in our body. And why is that important to me? Well, if your thyroid's not functioning well and we start transitioning, then you might need some supplementation with some hormone to help you with that and maintain health. That triggers so many different things in our body. Thyroid's super important to also our immune system, and it's important to our mental health. Many times, even working in the past, I've had clients that were in assisted living and they stopped taking their thyroid hormone and they became depressed. So, I mean, it affects your mental ability and stamina. So, certainly that needs to be looked at. What am I missing?
Well, just back on the thyroid. So free T4 is not as active as T3 and
At the
some
cell level.
right cellular level. So free T3 is the more active form. T4 gets converted into T3, but not everybody does it well. The most common form of thyroid being prescribed is T4 alone. So we're going to get into that later on in this series about what hormones to check and what how to order labs and the best way to interpret them. Janet, explain how metabolic issues might affect hormones and what should people be looking for. Can I talk on that really quick?
Yep, go for it.
So basically, and Janet kind of already alluded to it without saying it, but if your body is not having regular cycles, there's probably a metabolic issue going on.
And has been for a while.
Right. And there has been for a while. So one of the first questions we ask women when they're in their 40s and they're having, symptoms of deficient hormones, we start asking about, well, when did you start cycling? Were your cycles regular? Did you have, was it easy to get pregnant? Did you have any miscarriages? And, if their cycles weren't regular and they had miscarriages, chances are their hormones have been off for quite a while. So, and that a lot of times is a metabolic issue, which means that it's a lifestyle diet type issue. Talk about that, Janet.
So, and I'm going to be super clear about this. Even if you are a thin person or thought to be a healthy person that way, 30% of our patients that have PCOS may be thin. It is still, you still have a hormonal imbalance. So it's not just, your weight. However, weight does play into this and impact this very importantly. Like, I can't stress that enough. So where this is impacting you is at the cellular level. Can you handle the food that you are ingesting? And super important is how much is your body responding to the hormone insulin that's being released. If you're not responding to what your body's releasing and your cell's not able to grab that nutrient and usually glucose into the cellular level, you're in a storage mode, or you're in a mode of what we call inflammation, because your body's like scared. It's like, I don't know what to do. I can't handle what you've just gave me. And that happens for years on end to somebody, even if you are at a lower level of weight and you look healthy from the exterior. It does not mean that you're not having inflammation. So inflammation is a problem because inflammation impacts all organs and all tissue in our body. You can't excuse it. It's going to affect your brain, your heart, your muscles, your bone, I mean, everything in our body. So that is a major importance. And why it plays out this way is because we just get into this place where we set ourselves up for cardiovascular disease. We set ourselves up for insulin resistance, which leads to diabetes. So all case mortality, cancers, you name it. Immune system disorders like rheumatoid arthritis, fibromyalgia. I mean, it plays out in our body in different ways for each person. So getting control of that is super important. So there's times where I will look at a woman in perimenopause and her fasting glucose is super high. And really what that might be really important, and it is, in her A1C, which is a test to look at,
90-day
how,
average of
right.
glucose.
But I also want to know what her insulin level has been. So that could be really important. But why we look at that is because you can make changes in your daily lifestyle that's going to impact your hormone production and also the inflammation in your body. And this is something that, Shawn and I scream from the top of the mountain: protein, protein, protein. Women forget how important that nutrient is. If you are just eating Starbucks and you're grabbing something at a fast food place and, this fast mode or processed food, you're setting yourself up for metabolic disorders. And obviously, that's kind of a part of our culture, but you need to get away from it as fast as you can. And you need to have real protein in your diet too. And also fat. Fat is still an important nutrient. You can't just live on carbohydrates or sugars or processed food to be a healthy individual. We need fats. We need it for our brain. We need it for our tissue. We need protein to rebuild tissue. So that's one of the first places that I start talking to women about is, what are you eating? What's the importance that you have in your life? And that's something, unfortunately, that most primary care professionals are not talking about. They're not talking to their clients about how to prioritize nutrients.
No. And realize that if you do prioritize protein and along with fat, that one of the ways that you'll become metabolically healthy is that you can go for longer periods of time without eating. Typically, people that have high glucoses and high insulin levels, they're in a constant overfed, undernourished state.
Right.
So one of the best ways to fix that is focus on proteins and fats, and you can fast longer, and your insulin levels and your blood glucose will come down. Let's go ahead and get into labs, Janet. Some women are taught that, and we even talked about in our previous episodes, how useful lab testing is during perimenopause. Is it useful? Sure, it's useful if you know what tests to order and how to interpret them.
Right.
I think that's important. That's why it's important to go to a hormone specialist. So let's talk about, what labs would you recommend during perimenopause to test?
So I'm going to start with the primary hormone cortisol, which we've barely talked about on our series, but cortisol trumps everything. It's our primary hormone that's going to be the flight or fight mode. That trumps everything in our body. So I want to know what their cortisol level is. So that should be a morning test. I also want to know what their DHEA is, and that is usually overlooked because DHEA is really a hormone, but it also reflects how you are aging and what your lipid panels might look like. DHEA is connected to our cognitive functions over time. So if it's low when we're young, we want to make sure that you supplement. I want a vitamin D level. And the reason that's important, Shawn and I talked about that briefly, is vitamin D looks like a hormone. It has a lot of functions in our body, helps with our bone health, helps with immune system. So we want that in a test. We also do check estradiol levels, our estrogen levels, as well as progesterone. And then I want a free T or a free testosterone level because I want to see what's floating, but I want to see what happens in the morning. And it's kind of a diurnal pattern throughout the day. So it will start high and then go down throughout the day. So that can be interpreted as it is. But I want a thyroid level. TSH to me really doesn't mean much. I want free T4 and free T3. What am I missing? Anything?
I think I got them all. I just want to touch on what the free levels mean. So the total testosterone, total T4, total T3 is the total hormone floating around in the blood. But the problem is it's bound to what's called blood proteins. And when it's bound to a big protein, it can't get into receptor sites. So we want the actual free level. So we got to know what the free level is that is actually working at the receptor. So those are more important. I don't think we missed anything.
No, but
Um,
here's one thing. Sorry to interrupt, but here's one thing about hormone levels that Shawn and I have alluded to earlier. Interpretation becomes super important because if I get a free T3, which is free thyroid in the blood, it depends on what time of the day that level was taken and what symptoms they might be
well, and
having.
especially if you're supplementing. If you're
Right.
supplementing, it's a whole different animal. But if you're not on anything, you can test in the morning and try to be consistent with your tests. But if you're supplementing, it depends on when you're taking the hormone and when you're taking the test. So it's
Right.
important to know how to interpret those levels, and because they might look super high, they might look super low depending on timing. So
Right.
we deal with this every day. Most important thing is, how are you feeling? What are your symptoms? What's your history?
Right.
That's really the most important thing
And
when it
also
comes to
maybe
hormone testing.
and also maybe be a little consistent. Try to do it, you know, at the same time if you can, which is not perfect. But then remember too, you're dynamic. So we are not, I mean, things can change. Stress changes things, especially during perimenopause. I'll just reflect back in my life. I thought I was almost in menopause, and then I had a family member that passed away. Lo and behold, I had a cycle. So changes in stress and life can affect our hormones, and so sometimes that's just part of it. But labs are a tool. They are not always going to give you 100% what you're going to recommend for somebody, but they're part of it. So symptoms and how you are feeling in life are super important. So don't ever let any practitioner discount how you are feeling and what you are presenting physically.
And I want to Janet hit on TSH. So TSH is thyroid stimulating hormone. It's made in our brain and the pituitary gland to tell our thyroid to make more hormone. So it's a pituitary hormone. It's not thyroid hormone. So it's the gold standard for checking thyroid, but I think it's a good screening tool at best. You really want to know what your actual thyroid levels are. And here's another good example of that. When we check testosterone levels for men, for instance, we don't necessarily check their LH and their FSH, which are both pituitary hormones. LH specifically tells the testes to make more testosterone. But if your testosterone is low, your testosterone is low. It doesn't necessarily mean, especially if you're over like 40, it doesn't necessarily mean much to check your LH. So if you have a doctor and they're checking FSH and LH, I can tell you those tests, which FSH is follicular stimulating hormone and LH is luteal hormone and luteinizing hormone. and they're pituitary hormones, and they tell the ovaries to make other hormones, estradiol, progesterone specifically. But you know what? They're useless. If you don't have estradiol, you don't have progesterone. You need estradiol, you need progesterone. Why does it matter what FSH and LH is? There are some ways to use FSH and LH to kind of predict PCOS, but that again is just not usually always necessary, because you can use symptoms and history alone, because that's what the treatment is gonna actually do. So
Labs are at best a tool. They are important, but remember, we treat humans, not paper.
yeah, that is so true, and that actually winds up this episode of our women's health series. And stay tuned as we go more into menopause. And let me just define what menopause is. Meno meaning menses, pause menses. The strict definition of menopause is that you haven't had a cycle or a menses for 12 months. But I will tell you that doesn't necessarily mean you're not going to again. Janet just explained her situation, and we were kind of surprised when that happened, because we were taught that we thought that she was in menopause and wouldn't cycle anymore. It's just another reason to realize that our bodies are wonderfully made, and when we try to put our bodies in a box and explain things simply, it doesn't work. So if you go to a doctor and they tell you you're in menopause, you're not going to cycle again, don't necessarily believe them if you have all your parts left and they haven't taken those out, because you might cycle again. Don't necessarily believe them also that you can't get pregnant. Janet's mom was told that, and she got pregnant. And that's happened over and over again. So doctors are not always right.
They're not gods.
No, not at all. So
they're human.
Stay tuned for our next episode where we talk more about menopause. Thank you.